On this edition of Veterans Health Watch, we'll learn about the VA Maryland healthcare system's research programs that utilize exercise and robots to help keep older veterans healthy or to recover from a stroke.
We'll also learn about the VA's new Family Caregiver program that provides additional support to veterans who choose to receive their healthcare services at home.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your host, David Edwards, and I'm happy to be joined by my co-host, Kenya Griffin. Kenya, thank you for being here.
Thanks for having me.
Joining us today is Dr. Andrew Goldberg, the director of the Geriatric Research Education Clinical Center for the VA Maryland healthcare system, and Dr. Alice Ryan, a VA career research scientist. Thank you both for being here today.
Thank you.
Thanks, David.
Dr. Goldberg, I understand that you were recruited by the VA in 1990 to come and create the Geriatric Research Education Clinical Center. Can you tell us a little bit about the history of how this all got started?
Sure, it's my pleasure. The GREX, or what the acronym is for the Geriatric Research Education Center, was established in 1975 by the VA when they realized a need to improve the health of older veterans because of the specialty of geriatric medicine and the need to provide care for people who are disabled and suffering from chronic diseases. The GREX have led the mission of the VA in providing outstanding care for older people, advancing the field of research in geriatrics, and also providing a home base for training geriatricians in this difficult time when medical practice is becoming so technologic that we really don't focus on patient-centered care. So the GREX have provided a base for training, and almost every leader in geriatric medicine in the United States has been trained at some point in their career in a VA. There are now 20 GRECs in the VA. We were number 13, and they've continued to be developed up until the year 2000. When we got our GREC, its mission followed the mission for Healthy People year 2010. That was our goal, to improve the health of older people by helping them assume a more healthy lifestyle. That means exercise, weight control, environmental factor control, living well, and stopping all of the habits that are associated with bad health. We also tried to integrate teams of caregivers. So we had interdisciplinary teams of social workers, pharmacists, dentists, providing care for older veterans. Our nursing staff, we have nurse practitioners, and these nurse practitioners have provided important care for our veterans. The goals of the VA have led to our ability to provide better care and better training for older veterans. So we have research, we have clinical care, we have training, and we work with our affiliate at the University of Maryland to train primary care doctors to care for older people.
Outstanding.
And Dr. Goldberg, why is the research conducted at the GREX so important?
Well, the GREC is, our GREC's mission is to improve the lifestyle of older people and their health through just getting them to practice healthy lifestyle habits. So we focus on diet, regular exercise, taking your medications, and stopping those bad behaviors which hurt your life, like smoking, illicit drugs, the non-compliance of not taking all the medicines that your doctors give you as you grow old. If you have a grandmother or even your parents, you see them taking 7, 8 drugs. Almost everybody in America over the age of 60 is on a statin. So we're giving more medicine, and we try to educate our older people to take these medicine. You see the plastic pill boxes, the 7 days. We teach our patients how to divide up their medications. We counsel them on what's important, and we, more importantly, provide them with opportunities to participate in what we call clinical demonstration projects to show the benefits of exercise and weight loss. And Dr. Ryan is going to talk a little bit about this because she's one of the scientists who I've recruited to combine with the clinicians so that we translate her discoveries into the clinics to improve the health of older people.
Well, that's a perfect segue. Dr. Ryan, specifically, could you talk about the focus of your research?
Sure. Like Dr. Goldberg mentioned, we study the effects of lifestyle interventions. So aerobic exercise training, resistive training, nutrition and weight loss programs, and how they can reduce risks for cardiovascular disease, diabetes, stroke. And so we study the cellular mechanisms. We look at changes in the muscle, in the adipose tissue, in bone, and we can show that exercise can reduce and change how you mobilize your fat stores, how you can increase your bone density, or you can have muscle hypertrophy with strength training in very different populations, people who've had a stroke, people who are just overweight. And we try to tie all these things together and show how we can improve the lifestyle and health of older veterans.
Well, Dr. Ryan, how does the heightened prevalence of obesity in the veteran population increase their chances of suffering from a heart attack or a stroke?
Yeah, it certainly does. We can store our body fat in different places. We can store it in the abdominal area. We can store it in our muscle, and we can modify those fat stores, and we can change how we metabolize our blood sugar, and we can do that through exercise, and we can reduce the risk for diabetes and stroke through these lifestyle interventions.
Dr. Goldberg, what are some of the future goals of your researchers in the GREC at the VA?
Well, the GREC is very fortunate that we have both MD, basic science, and health professionals all collaborating in our research. So it gives us many opportunities to advance the science of exercise and diet in improving the health of older veterans. The big problem facing veterans today is the obesity epidemic. 70% of veterans over the age of 50 are overweight or obese. 35% of them are obese. So that means you have a body mass index above 30. And indeed, in our clinics, the BMIs of our veterans are 35 to 40. And if you think that 40 years ago, that 60-year-old veteran was one of the fittest people on the planet, it's really scary to think that these people have gotten sick and their health has deteriorated. So the importance is that through our research, which focuses on lifestyle, we can hopefully reduce medication costs. We can get these people participating and able to return to work, socialize, remain active in the community. And these are things which prevent accelerated aging. They just prevent the declines in function that occur. We try to get people out of their house into senior centers, and the VA does such a great job with that. There are senior centers all throughout Maryland. I've gone out to American Legions. I've gone out and given talks at senior centers, and that's critical to helping these people improve. What I'd really like to see as these veterans have arthritis and are overweight is putting more athletic facilities that are good for older people. Swimming pools where they can walk, places where they can get exercise to keep their joints and keep them more mobile, and more importantly, where they can train their balance and do things to prevent falls, which is a huge problem in people as they age. So we're trying to look at the future and trying to improve things to allow these people to live a healthier lifestyle and be more participatory in their activities.
Well, we have to wrap up this segment, but I'm sure some people are now interested in your studies. How can a person, and not just a veteran, learn more about participating in one of your studies?
You can call our recruitment hotline. We have one for overweight people and diabetics, and we have one for spouses also. And we also have a hotline for recruitment of patients with disabilities into exercise programs for stroke, as you're going to hear about from Dr. Forrester and Dr. Wittenberg. So there are lots of ways that people can come and participate in our programs. We have a 5,000 square foot exercise facility. in the VA currently, and we'll be moving to new facilities just down the street on Fayette Street, 200 block of Fayette. And it's a beautiful building, it's well lit, there's easy access, and our veterans can come there and participate in a wide range of physical activities to improve their health and quality of life.
Dr. Goldberg, Dr. Ryan, thank you both so much for being here today. I think this was very educational for our viewing audience. We're going to take a break right now, but when we return, we'll be learning about robots and how they can help with stroke rehabilitation, so stay tuned.
In a continuing effort to better serve the healthcare needs of our nation's veterans, the VA Maryland healthcare system offers a 24-hour telephone care line. Enrolled veterans can seek round-the-clock medical advice or ask questions about their medications by contacting the telephone care line 24 hours a day, 7 days a week at 1-800-865-2441. Veterans who need to schedule a same-day appointment can also call the telephone care line Monday through Friday between 7:30 a.m. and 4 p.m.
Welcome back to Veterans Health Watch. We're now going to be learning how robots can actually help veterans regain movement and other abilities after a stroke. Joining us now are Dr. George Wittenberg, Deputy Director of the Maryland Exercise and Robotics Center of Excellence, and Dr. Larry Forrester, Associate Professor in the Department of Physical Therapy and Rehabilitation Science and Director of the Human Motor Performance Lab at the Baltimore VA Medical Center. Doctors, thank you both for joining us today.
It's a pleasure.
Dr. Forrester, what exactly is a Human Motor Performance Lab?
Well, our lab is a facility that was provided to us by the VA R&D service several years ago to allow us to measure and quantify human movements. Because in our work in rehabilitation, we're interested in movement function. So if someone comes in who's had a stroke or some other injury, we can actually, for example, take three-dimensional films of their walking and discern what areas are a problem. And then if they go through a rehabilitation treatment of some type, say treadmill training, we can refilm them and see which areas may have been improved or affected by that sort of intervention. And along with that, of course, we have several other measures that allow us to measure muscle activity, forces generated, how strong they are, those kinds of things. And recently we've added the ability to study brain activity, which is something maybe we'll touch on a little bit later.
Well, Dr. Forrester, what types of issues do you look at specifically in people who've suffered a disability after having a stroke?
Right. Well, most of our work in recent years has focused on stroke. So many individuals after a stroke will experience a weakness on one side of their body, and this can affect their ability to use their arm and their hand to reach and grasp, and certainly in many people it affects their ability to walk in any sort of economic way. They often have a severe limp. And this limp poses problems that can lead to falls and certainly slower walking and less function in their daily activities. So as we come up with interventions like treadmill training or resistive strength training, we'd like to know how we can improve this walking ability. But the kinds of problems they have through the weaknesses, for example, if you'll forgive me, but they might have what's called foot drop. So the weakness down through the ankle doesn't allow them to position the foot to safely plant their foot and continue walking. Recently, to try and address that particular problem, we've collaborated with MIT up in Massachusetts to use a robotic device called the AnkleBot, because we believe that by training with this device that perhaps we can enhance that part of the whole walking system to move them farther along than we have been able to do so far. And I would add that our gait rehabilitation studies have been very successful, but we're still pushing on for even greater success.
Well, to expand on that, Dr. Forrester, what has your research shown so far?
Right. Well, particularly with the robotics, we've been very intrigued. We have a setup where individuals sit in a barber's chair and they wear the robot, which hooks onto their lower leg, and essentially they play video games with their ankle. Mm-hmm. And we can construct these games to be easy or hard, and we try to make them incrementally more challenging as the individual is more and more able to use their ankle. Of course, in the end, and what one of our recent studies showed is that by doing this type of what we call visuomotor training. It's kind of jargon, but they're looking at a TV screen and moving their foot. It actually conveys to slightly better walking. So as preliminary work, it's encouraging, and we're continuing to pursue that. We've added, in the last year, with another VA investigator, the idea of adding a brain cap or EEG. And so we want to understand how the brain patterns that as a person uses this device may change as they become more efficient and effective. And again, this is a window on what we call motor learning, which is probably a very important process in rehabilitation.
This is really intriguing research. Thank you.
Well, Dr. Wittenberg, Dr. Forrester mentioned some of the lower extremity robotics, and what about some of the other robotic studies you have going on?
Right. So the work that I'm involved in is all focused on the arm, and so on restoring ability to move the arm, to grasp, and to do important functions with the hands during the day. And in stroke, this is very commonly affected. So we've actually completed some studies recently, including a VA cooperative studies program trial, which involved 4 VAs, of which ours was one. And this took people who had had a stroke more than 6 months ago and had rather severe problems in using their arm. People for whom it really wasn't thought that there was a therapy that could actually help them move better. And what we found is that with 12 weeks of intensive therapy with a robot, but also with other types of devices that allowed them to really practice movements, they got better. There were significant improvements in ability to move the arm and significant improvement in quality of life. Those results were published in the New England Journal of Medicine last year, and I think should really give a lot of hope to people with severe deficits after stroke. Another interesting side of that is that we tested the brain changes that occur with that sort of improvement, and found actually a more effective connection between the part of the brain that controls movements most directly with the muscles of the arm, and secondly, changes in the connections between different brain areas. So we actually are changing brains with this kind of functional improvement.
Are the robots that you're using as part of your research commonly used in physical therapy settings?
Mm-hmm. They're not very commonly used, but there's been a technology explosion recently in which the robots that we used, which were designed by IMT but now produced by a commercial company, and other companies have actually received FDA approval for these devices. And they're actually more and more present in therapy establishments around the country. But the research work that needs to be done to show who benefits from them, how they can be most effectively used, is still very much remaining to be done.
Well, Dr. Wittenberg, could you tell us about some of the results you found from these research studies, and what direction are you taking in the future?
Right. So, as I mentioned, we've shown that people can improve with robotic therapy. They can. We've defined exactly what sort of robots work best and what combination, and so we're basically refining the type of therapy that people get. What we're doing now is actually working on 2 fronts. One is how can the movements that are restored by the robot be best integrated into daily life, and so we've taken sort of the best of the robots that we've used so far and the best of the methods, and actually combined that with what we call a transition to task practice, where people start using those movements not to just move the handle of a robot in a video game, but actually do practical things like turning a key in a lock or drinking a cup of coffee, for instance. And the people who are involved in that study are getting now more detailed examination of their brain changes, and even how the connection between the motor part of the brain and their hands changes with a single session of therapy. The second thing we're doing, which I think is equally exciting, is that we're investigating how stimulation of the brain with a technique called transcranial magnetic stimulation can actually work together with practice to increase the amount of change that occurs with practice. And so in doing that, we're actually combining an external stimulus with a magnet to the brain along with the person's own decision and ability to move. So those are two studies going on right now. One for the first one for people who are more severely affected, and the second one for people with more moderate disability, so we can understand how we can tune up their ability to move at that point.
Dr. Wittenberg, we're going to be going to a break very shortly, but can you give our viewing audience some information how they might find out more about your program or how they could participate in the program?
Right. So recruitment into our clinical trial can be done by calling the same recruitment number that was given before and which you should see now. For a study involving the stimulation with practice, we have a research coordinator, Jamie Lush, who would be happy to take your information.
Dr. Forrester, Dr. Wittenberg, thank you so much for joining us today. I really think our viewing audience learned a lot about what you're doing in your exciting research program.
It's my pleasure.
We're going to go to a break right now, but when we return, Chris Buser, our remote reporter, will be at the home of one of our veterans to show us and tell us more about the VA's new caregiver support program. So stay tuned.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
I really didn't think I was qualified because I didn't have a service-connected disability.
Recognized for its state-of-the-art technology and quality patient care, the VA Maryland Healthcare System is a progressive organization that provides a full continuum of care to veterans. The VA Maryland Healthcare System is committed to serving the needs of veterans at 8 locations throughout the state.
At the VA Maryland Healthcare System, we're proud of our investment in technology because it's an investment in our veterans.
The categories of care have been opened up so that more veterans can qualify.
Tell a vet to call 1-800-463-6295 extension 7324 to inquire about enrolling in the VA Maryland Healthcare System.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Welcome back to Veterans Health Watch. Today we're at the home of Jason Earhart, a U.S. Army veteran who was injured in Iraq in 2005. We are also joined by his mother Pam and also Sharon Kelly, the Caregiver Support Coordinator for the VA Maryland Healthcare System. Thank you for having us out to your home. Jason, I wanted to start with you. In 2005 you were injured by a roadside bomb. What sort of injuries did you sustain?
Brain injury, burns, amputation.
Mom, what kind of injuries did the doctors at Landstuhl tell you about that Jason had sustained?
Well, originally they had just told us about the burns, and then as the days wore on, they discovered the brain injury, and then he did come out of it with both legs, but he ended up having to have an amputation as well.
Pam, after Jason was transferred to the VA for his care, what sort of rehabilitation services did he receive from the VA?
He was transferred for his rehabilitation, and he started out with cognitive therapy, physical therapy, occupational therapy, and speech therapy.
Sounds like they've really helped him on his road to recovery.
They absolutely did. He had excellent care.
Sharon, I understand that the VA has recently implemented changes to its caregiver support program to build upon the services that has traditionally offered VA caregivers. Can you tell us about some of these new enhancements?
Sure. I'd like to first start off by kind of discussing the benefits and services that the VA has always provided to caregivers of veterans of all eras. Services such as respite care, home health care, adult day care, and things like that. So that the newest part of services that are currently being added is the monetary benefit as well as caregiver training.
Sharon, how does the VA define a family caregiver?
The VA defines a family caregiver as a primary provider who provides personal care services to the veteran, and the caregiver should be 18 years of age or older. The primary caregiver could also be a step family member, an extended family member, as long as it's someone who resides in the home with the veteran.
Once a veteran has been determined to be clinically eligible for the program, what sort of services are in place to support the caregiver?
So in terms of the eligibility criteria for the caregiver support program, Certainly, the veteran must be enrolled in the VA Maryland healthcare system. Secondly, the veteran must have sustained a serious injury on or after September the 11th. And the serious injury could include mental health conditions such as post-traumatic stress disorder, traumatic brain injury, or another type of mental health disorder. Additionally, the veteran must be in need of a minimum of 6 months or more caregiver services due to an inability to perform one or more activities of daily living, such as bathing, grooming, feeding oneself, or the veteran must be in need of supervision due to seizure disorders or blackouts.
Are there additional services that a caregiver can receive?
Certainly. Additional services that a caregiver could receive would be a health insurance benefit provided by CHAMP VA, and this is providing that the caregiver does not already have existing insurance. Another benefit would be mental health services.
Sharon, for caregivers, is there a type of training that's in place for them?
Certainly. The training that is offered for the Caregiver Support Program is provided by Easter SEALs, who offer various types of training, which is online training, a workbook training with the DVD, as well as classroom training.
Okay, excellent. Pam, when you brought Jason home from the hospital, what sort of changes did you need to make within your family and within your home to properly care for Jason?
Well, in order to even bring him home, we had to go through some pretty extensive medical training for his injuries, and then we had to make some home modifications. But more importantly, he needed round-the-clock care, so we had to make arrangements for someone to be with him all day, in the evenings too, so between us.
And the training that you mentioned and the modifications, were those things that were provided to you through the VA?
Yes, in fact, as far as the medical training went, before we were even allowed to leave the hospital, we actually had to spend the weekend in the hospital with him, taking care of him with nurses nearby. And then prior to him even coming home, the Baltimore VA sent someone out to do a home assessment and then make the recommendations for the modifications, and then supplied us with everything that we needed.
What sort of advice would you give to families who are out there watching us today and thinking about applying for this program?
Well, while I think the caregiver legislation was excellent and something that we needed, I was a little wary at first to go through it because I've already been through so much medical training, and I thought it was repetitive, it was redundant. I thought it was going to take up too much time, and it really wasn't going to get much out of it. But I'm pleased to say that with the help of Sharon here, she got me through a lot of it. It really didn't take very long to get. It wasn't a cumbersome process to go through, and it was well worth going through the process. And we're particularly looking forward to the respite care. And although the VA offered that in the past, the offering was that Jason would need to go to the hospital and stay in the hospital. And with this caregiver legislation, we can have respite care here at home.
Sharon, how would a family caregiver or a veteran learn more information about this new VA program?
Certainly they can go to the VA website or contact the Caregiver Support Hotline at 1-855-260-3274.
Jason and Pam, thank you so much for allowing us to your home today.
Oh, you're welcome.
Sharon, thank you so much for the valuable information you shared with our TV audience. Now we'll throw it back to the studio.
Chris, thank you for that special report on the VA's new Family Caregiver Program. Well, that wraps up this edition of Veterans Health Watch. If you'd like to make suggestions for future topics or have questions about today's show, please call us at 1-800-463-6295, extension 7101, or join us at www.maryland.va.gov, or you can follow us on Facebook or Twitter. We look forward to hearing from you.
See you next time.